John. Thanks for coming in today. How are you doing? Thanks for seeing me, John. I'm well. A bit tired after this term and having some pain, but I'm very enthused and optimistic about what I've gained. Tell me about that. What have you gained? In my Theories and Techniques course, Ron Jaden introduced us to cognitive behavioral therapy, rational emotive behavioral therapy, Gestalt theory, and narrative therapy, and some versions of play therapy. They're all very interesting. No doubt. Is there any one of these that stands out as most useful for your future practice? Question. Mostly we studied theories, which always fascinates me, and I want to add my own interpretations and adaptations to them. I'd be happy studying and writing about theory all the time, but I have entered clinical mental health to pursue practical application of knowledge. I've never done anything practical, so this is a new experience for me. Yeah, I've noticed that you tend to space out. So about the practical, is there a technique that you can center on and get good at? John? What did you say? I said, is there a technique that you can choose to work on and get good at? Good question. Last term, I aligned with solution-focused therapy very strongly. I like the minimalism of the technique, questions to guide a client to their own solutions with little speculation about problems and causes. It's a pragmatic therapy for a skeptic such as myself. So you're going for solution-focused. But Ron Jaden did not teach that this term. But solution-focused therapy is highly adaptable. There are versions of solution-focused cognitive behavioral therapy, solution-focused narrative therapy, solution-focused dialectical therapy, and many others. In fact, it seems to me that every one of the theories have insights that are worth adopting, and every one of the therapies have techniques worth incorporating. So you're an eclectic therapist? No, not at all. Chaotic maybe, but not eclectic in the way that counselors use that term. What do you mean by chaotic? Okay, whatever. How is that not eclectic? Well, eclectic means that the counselor does not identify with a specific theory, but uses whatever seems appropriate in the moment. See the point of that? But my intention is to ground in theory as a base, to align that theory with other theoretical techniques in order to employ variations of the base theory to different clients and situations. So solution-focused therapy will be your base theory and technique? Right, so far. Look, De Shazer and Berg developed solution-focused therapy out of concepts from the philosophers Socrates and Wittgenstein and hypnotist Milton Erickson. I've studied all three of those thinkers for most of my life. I totally think that I can write about this, but more important, I can grok the logic and purpose underlying the technique. What totally sold me was Kim Berg's training videos on solution-focused therapy. So positive and respectful and impactful, and the clients are elevated to the role of finding solutions. That's brilliant. How about the whole set of videos? Berg is awesome. Okay, so you're a fan. But how does that relate to the other theories? Good question. You're an artful inquisitor. So let me ask you, if you could imagine my answer to that question, what would it be? Me? I don't know. Maybe that. Let me think. Well, Gestalt therapy has empty chair technique. So maybe you could enable a client to ask and answer their own solution-focused questions? Not bad. You're pretty sharp. So what about narrative therapy? I'm sure that you're aware that Chang and Nyland addressed the synthesis of solution-focused therapy and narrative therapy. Both are about eliciting stories that clients tell about themselves, so they have a lot in common already. I'm starting to think that you and I have a lot in common as well. What about cognitive behavioral therapy and rational emotive behavioral therapy? Do they have anything in common with solution-focused therapy? Are established branches of SFBT, CBT, SFBT, REBT, among others. By the way, why do you avoid acronyms? You know that's how counselors talk, right? Seems so. Yet I think that having a special language among counselors creates an in-group mentality which average clients cannot access. I'm more egalitarian than that and hope for my writing and speech to aspire to general transparency rather than privileged code. That's what we get for letting a philosopher in. IDK, YOLOIMHOOMGMAGAFUBAR. Whatever. So where do you go from here? I need more training. The best thing this term was the role plays that Ron Jaden conducted. We should be doing those every week. I learned from my mistakes. I learned from other learners. Ron really shared some gold. This experience is what makes me think that I can actually do counseling. In the meanwhile, I got certified in psychological first aid. I want to get trained in trauma therapy and eye movement desensitization and reprocessing. I want to do more with family structure maps, technique, develop my Munchen, and Gestalt therapy. Well, you certainly have your work cut out for you. True. But what else is there to do? You could retire and take it easy. Are you serious? Not really. Let's go for it. Laughter yoga.